We check in with you regularly. Good to see you once again. How many doses have you administered?
Well, my practice is scheduled to be week 3, which is next week. So our vaccines are due to arrive today, and we get 50 doses. So we're very excited. Let's just hope the delivery arrives today.
Okay, so in your recent experience, when deliveries say they're going to arrive, do they?
Look, I'm in the privileged position of knowing what's happening across our state, and unfortunately, no, it's been a little bit erratic and very difficult, can I say, because GPs want to be able to roll out the vaccine as quickly as they possibly can. But, you get told you're going to have, so for instance, there's a couple of practices that were due to get 300 doses and the 300 failed to arrive. So they then had all of those patients to have to contact, reschedule, and hopefully have the vaccine arrive in time. So it's been a bit of a mess.
Well, what we're hearing from you and what we're hearing from the Health Minister, Greg Hunt, is just so different. What's happening in between? I know that's a hard question for you to answer, but can you go some way to explain that for our viewers?
Look, I think it's the classic sort of systems organisation thing where they've contracted the delivery people to deliver. To be fair, New South Wales has had floods that arrived at exactly the wrong time in terms of deliveries of the vaccine to the first rollout practices. And that made it that much more awkward. And then you got lost, those numbers sort of then tumbled into the other deliveries behind them. But really, from my perspective, that's where the issue lies. We need to have, can I say, like an Amazon book ordering, or the whole produce thing where you order, exactly how many they are, you can then track exactly where they are, and the minute they're going to arrive at your door, and you can have interaction with it. But we just don't have any of that. For instance, one of my colleagues out in Dubbo, they got told that it was going to be delivered within a 12-hour time frame. I'm sorry, but you probably do know where the truck is.
Yeah.
They're a bit tighter than a 12-hour time frame. And when they wanted to pin it down because they actually had to go and run some outpatient clinics, and there wasn't going to, that was on a weekend, so about when you actually had to have staff, they got told, well, if you don't want it, we'll just cancel your delivery. It's like, well, it's not we don't want it. We just need to know the time.
Right.
And that's really tricky.
It sounds very frustrating indeed, Doctor. So what's happening once you get the vaccine? Let's stay on the positive here. How quickly are you actually getting them into arms?
Look, that's been amazing. So if you look at the numbers across Australia, the numbers are arriving and they're instantly going out. And, again, if you just think for me of my 50 doses will disappear the minute they arrive. So if you'd given me 100 doses, those 100 would have disappeared as well. So general practice has got a vast capacity to actually make use of every vaccine that arrives, and we can roll it out very quickly within that time frame. It's, for us at the moment, it is a supply. Give it to us and we can roll it out. Everybody's ready and raring to go. They've got their patients that they know they need to contact. They've got the bookings for each practice is sorted out. It's not a national system like was promised, but each practice itself has a system, and from what I can tell from everybody, it's been remarkably smooth and fantastic and really well received. Everybody who's had a vaccine has been, really helpful in making sure it goes smoothly as well.
Yes, well, that's good news indeed. Just one final question, because we're still getting anecdotal evidence that in some practices, doctors are charging, not to get the vaccine, but a consultation that it might be required in order for individual patients to get a vaccine. Now, if there's underlying health issues, I think it's probably fair enough that doctors can charge for those consultations on the side, but does there need to be perhaps a relook at this so the federal government can, look at those individual cases, and a small amount, I imagine they would be, that need that extra bit of consultation if they've got, underlying blood disorders or blood clotting issues, that they need that extra consultation. Doctors, their time is precious. They should be able to charge for it, but should the federal government be picking up the bill?
From my perspective, absolutely. The whole reason for rolling it out in general practice is that we know our patients, that we particularly know our vulnerable patients well. But because of the way it has been rolled out, there's a number of practices that won't be doing it. And so their patients are having to go to other practices. And I think quite fairly, the GP who is then being responsible for giving it needs to just be sure that everything is explained and the patient is appropriately assessed and managed before they go into the vaccine. And for me, for my own patients, I've been having that opportunity to add those conversations into other care that I'm doing. But if the patient's completely new to my practice, then I need to also have a bit of an assurance around it. The COVID vaccination item number reimbursement, which has to be bulk billed, is a very small amount of money and doesn't cover for anything apart from the process of giving the vaccine.
Okay, well, we'll try and get that question to Greg Hunt, see if we can get that consultation issue sorted out as well. Charlotte Hespe, Doctor, always, we thank you for your time once again this morning.
Thank you very much. Have a good day.